Assalamualaikum, my name is IZZATI AIMAN.
Assalamualaikum and hi. I am NURATIQAH RAMADANIAH binti MOHAMMAD.
Hello, I am NURIN SYAHIDAH binti ANWAR.
Assalamualaikum and hi. My name is MASHITAH binti NASIR.
In December 2019, a new strain of coronavirus, later identified as SARS-CoV-2 or COVID-19, began to surface in Wuhan, China. COVID-19 had become a pandemic which required emergency measures across the globe. Besides the cost of lives and health, epidemics and pandemics have devastating effects on the society and individual well-being. They strongly impact economies, livelihoods and psychosocial well-being across entire community. Implementing lockdowns to rapid testing and contact tracing strategies are the effective methods in controlling the outbreak. Surgical face masks and social distancing are compulsory to prevent transmission of the virus, along with the use of hand sanitizer. In dealing with the pandemic, medicinal knowledge, public awareness and social behavior are the major aspects for the effectiveness of managing the COVID-19 outbreak. One of the things that we can learn from the management of this pandemic is transparency is necessary. Dr. Liu Wenyang had tried to warn the public about the unknown flu but was silenced by police for spreading false rumours. He was punished for blowing the whistle on the authorities' cover-up. Later, he was infected and passed away, which sparked nationwide grief and outrage. The Chinese government tried to cover up the virus with inadequate measures taken early on to stop the spread, which caused anger and frustration of the public. On the same day, Wuhan's Health Commission issued an alert to medical personnel detailing protocol on the treatment of recent cases of pneumonia from unknown causes. We should encourage medical and healthcare professionals to speak up when it is necessary regarding humans' health and safety. By providing visible and safe reporting channels along with the support from the public, transparency plays a vital role when it involves life-saving information to provide protection.
Next, decisive and strong leadership skills are crucial in managing the outbreak of COVID-19. New Zealand, for instance, has become one of the notable countries that responded effectively to the pandemic. Prime Minister Jacinda Ardern decided to take fast action by banning travellers from China starting from mid-February 2020 after had been advised by the health officials. By 23rd March 2020, New Zealand committed to a total elimination strategy and implemented a strict national lockdown despite having only 102 COVID-19 cases and no recorded death. By emphasizing science, leadership, and consistent messaging to gain public trust, Prime Minister Ardern managed to maintain the lowest number of COVID-19 deaths compared to the other countries that took longer time to impose restrictions.
Other than that, response and recovery for the management of COVID-19 can be considered as fast. This is because when COVID-19 struck the world, most countries had taken precautions by enforcing lockdown, including China, Italy, Australia, and Malaysia. Besides, the research and production of vaccines that recover the killing coronavirus were done by various countries in just 2 or 3 years. Oxford Uni-AstraZeneca, Pfizer-BioNTech, and Moderna are the list of vaccines that had been approved by FDA and widely distributed in the world to fight the SARS-CoV-2 virus. Even though at first the acceptance of the public on the vaccines is not that good, however, the public had been convinced by the minister, whereby they are among the first that getting vaccinated. Hence, up until end of 2021, it is found that about 70% of high-income family had been vaccinated, while about only 4.3% of people from low-income family had been vaccinated worldwide.
Lastly, preparedness and critical sector. In terms of pandemic preparedness, the pandemic COVID-19 has attacked Malaysia and the world. The spread of the COVID-19 pandemic has been observed to be rapid. In a move to prevent the virus from continuing to spread, the Malaysian government had to issue a Movement Control Order (MCO) regarding the increasing COVID-19 pandemic outbreak. The COVID-19 pandemic that occurred had significant effects on the economy and national development. The increase in the poverty level in Malaysia, which is at 0.4% in 2020, affects the employment sector compared to 5.6% in 2019. When MCO is introduced, the tourism, aviation, business and manufacturing sector are significantly affected, resulting in the unemployment of many employees. Because of the government's effort to stop the growth of the COVID-19 pandemic in the community, they forced many sectors to be closed. In addition, the absence of customer because of the compliance with the MCO is the primary reason most enterprises and business owners decided to close their doors.